am Rosmanajihah, representing on Revolution of Nanomedicine as an effective treatment in renal cancer. Kidney is a bean-shaped organ, and each person has one pair of kidneys, which are located in the lower abdomen behind the liver and stomach. Its function in osmoregulation, waste filtration, and maintaining fluid homeostasis, mainly to clean blood and remove waste in urine. Renal cancer, also called as kidney cancer, is a disease wherein kidney cells grow out uncontrollably and become a tumor. The tumor can be benign, indolent, or malignant. Renal cancer can be divided into 5 types, which are renal cell carcinoma, urothelial carcinoma, sarcoma, Wilms tumor, and lymphoma. The most common type of kidney cancer is renal cell cancer, with about 85% of the diagnosis. There are a few standard treatments for renal cell carcinoma. First, surgery is done to remove parts or the whole affected kidney. Second, treatment is radiation therapy that uses high energy X-rays or other particles to kill the cancer cells or stop the cancer cells from growing. Third is chemotherapy, which is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping them from dividing. In Malaysia, there are various drugs approved by the FDA for kidney cancer, specifically for renal cell cancer, including avelumab, avastin, axitinib, mitomycin, nivolumab, and temsirolimus. Next is immunotherapy, involves CTLA-4 inhibitor and PD-1 inhibitor. But this immune response involves many activities of protein to ensure the immune system can be activated when there are foreign particles detected in the body. One of the protein is CTLA-4, which is located on the surface of T cells. So when CTLA-4 binds to another protein on cancer cells like B7, it will stop the T cell from killing the cancer cell. The T cells should be activated by the binding of T cell receptor to antigen and MHC proteins on the APC, and the binding of CD28 to B71 or B72 on the APC. However, this binding also causes the attachment of B71 or B72 to CTLA-4, which prevents the activation of T cells and consequently unable to kill the cancer cells. So, for that reason, the binding of B71 or B72 should be blocked by immune checkpoint inhibitor, which is anti-CTLA-4 antibody, to allow the activation of T cells and kill the cancer cells. PD-1 inhibitor also apply the same mechanism, but involve different proteins. In normal physiology of kidney, glomerular filtration barriers in blood filtration, only allowing water and small solids like urea, amino acids, glucose, and mineral ions to cross the glomerulus from the plasma into the urine. High molecular weight plasma components and negatively charged components are retained in the blood. Therefore, a nanoparticle must penetrate the glomerular filtration barrier. For NPs designation, most of the therapeutic NPs are around 30 to 150 nanometer in size, and this size is not subjected to escape kidney filtration into the urine. Therefore, the size of NPs can be designed into smaller than 10 nanometer to cross the barrier if the condition of the barrier remains intact and not damaged by the cancer cells. In the blood, the flow of particles should be cylindrical and discoidal shapes because they will interact with macrophages and membrane of the cells, in which the minimal curvature will go through the blood flow rapidly upon incubation with macrophages. The elongated cylindrical called as nanoworm or nanorod also displays high tumor accumulation, but these shapes also depending on the aspect ratio and dimension of the NPs itself. In kidney filtration, highly positive charged molecules can penetrate into the glomerular filtration barrier. Therefore, NPs should be strategized with highly positive charge for rapid renal clearance from the circulation. In 2020, new kidney cancer cases is estimated to be dominant in Asia and Europe compared to the others, which means that Malaysia has high possibility to record new renal cancer cases. Further studies to test the effectiveness of nanomedicine in renal cancer can be investigated using kidney on a chip. Kidney on a chip is a kidney model that are created using microfluidic devices to imitate the tissue in vitro, consists of many cell types that are cultured in 2D under continuous perfusion. This system can be used to assess the nanomedicines that mimic physiological conditions of kidney, to screen the effectiveness of nanomedicines and its potential toxicity effect. The challenge in this application is to deliver and retain nanomedicine in the kidneys. Considering the size, shape, and the surface chemistry of NPs, deep understanding on kidneys anatomy and physiology is required to engineer nanoparticle with effective functions. Thank you.